I like to go over generally what you're going to experience during the surgical day, what's going to happen immediately after surgery, and the risks, benefits associated with a breast reduction. So during surgery, I'm going to meet you in the preoperative area. We're going to stand up and I'm going to mark you in a closed room or a curtained room. We're going to go over everything we talked about beforehand, the asymmetry present before surgery, where the nipple and the breast tissue will be moved to, and what skin and tissue will be removed as well. We'll have an opportunity to talk this out and talk about size as well. And then you're going to meet the nursing staff and anesthesia team. When the operating room is ready, we'll walk in. You're going to beautifully go to sleep with no problems. During operation, I'll be performing surgery myself. I'm with you the entire time. We're going to wake up in the recovery room. And in the recovery room, you're going to have your own nurse to be checking your vital signs, making sure you're okay. You'll have a padded bra on, lots of gauze padding inside, tape on the breast, which are steri strips, and drains coming out the sides that you won't even feel. I will also have injected you with a pain medicine that takes the edge off tremendously. This is not a painful procedure. The next day, you'll come to our office, which will be explained in a different video, and we'll be conducting and doing your whole post-operative process from there. The risks of a breast reduction are minimal. They're very, very low. If they're elevated, I wouldn't be doing it, but there are risks to any operation. But I'm gonna highlight verbally some things that I always think about. Bleeding and infection. Bleeding happens with exertion. So don't push, don't pull, don't lift anything off the ground, and don't reach. Try to keep your elbows in. You wanna limit not just force, but how much movement your body is doing. Roughly for about 3 weeks after surgery. At 3 weeks, I'll let you start doing light cardio. And at 4 weeks, you can start weights on a graduated basis, which I'll direct you for. Infection. The infection rate of a breast reduction is almost zero. And it's because we take such meticulous care of our patients. So antibiotics starts the night before surgery. Your prescriptions will be sent in. You will take your first dose the night before surgery. The day of surgery, we'll be giving you IV antibiotics. I wash the breast with antibiotics in the operating room. And when you go home, you will start the dose that evening. It'll be a morning, evening dose for roughly 7 days. If you experience any problems with antibiotics, any rashing, difficulty with your bowel function, or any other problems, please let us know. At 2 weeks after surgery, we get to tape off your incisions and we get you on scar gel. And we follow you for a full year. We have a very comprehensive post-operative scar program. If a scar is raised, itchy, thick, or doesn't feel right, we can inject it with a steroid that can help it thin out over the course of time. If a scar is colored, we have lasers at disposal to see if you're a candidate for a laser treatment. And at the 1 year mark, if there are parts of your scar that you don't like, I can always touch it up. But the most important thing is I need to see you. So please make sure you come see us. Symmetry, contour, shape, lumps and bumps. No surgeon on the planet can guarantee perfection because perfection doesn't exist. Even before surgery, there's asymmetry. But I won't let you leave the operating room unless you look amazing. But remember, the post-operative course is a process. It takes at least a year. Nipples can partly or completely die or lose partial complete sensation. This is a very, very rare thing in our practice. But what's high risk are smokers or vapors. Please, no smoking or vaping. It has to stop 6 weeks before surgery, and if you need to resume it, can resume 6 weeks after surgery. As well, nothing too tight on the chest. If a bra feels too tight, if the padding is too much, it can limit blood flow to the chest. So we'll teach you what that means when you come to your post-operative visits. The tissues can be a little hard after surgery. That's a relative normal process. Over time and massage, they soften and get better and will fall into position. So just note that the scars and the breast tissue will soften with time. The nipples may look like they're not in a perfect location after surgery. We almost do this intentionally because the breast tissue will rotate, they'll take a better shape, and the nipple will rotate with that. All of your breast tissue will go to the lab for analysis. The results take about 2 to 3 weeks to come back, and we'll report back to you if there are any abnormal findings. Breast reduction surgery can also yield some wound healing delays. Skin may not fully come together. When it comes together, maybe a little bit of a wound breakdown. If it does, we'll educate you on how to treat this under our supervision. After breast reduction, breastfeeding can still be performed. We do not disconnect the ducts that allow women to breastfeed their children. However, many patients coming for breast reduction may have never engaged in breastfeeding yet. So you don't know if you would have been able to breastfeed even if surgery wasn't performed. Unsatisfied patients, very rare in our practice. If patients understand the premise of surgery, they understand the expectations, and we never overpromise and we always overdeliver results. But if there's anything you're unhappy with, come talk to us. We want you to be happy. That's really the ultimate goal. And lastly, blood clots. Blood clots can start in the legs, God forbid it can break off, travel to the lungs. That's called a DVT, which is a deep venous thrombosis and a pulmonary embolus. We have never had this after a breast reduction operation. Why? The precautions we take. Number one, you're gonna walk after surgery. Walking is just to the bathroom and back or local walking. It's not recreational long distance walking. Secondly, is you're gonna pump your calves in bed to help promote circulation, which we'll show you in the office how to do so. But these two things tremendously lower the risk of blood clotting almost down to zero. If you experience any leg swelling, leg pain, one-sided issues, or even both-sided, please let us know immediately. If a patient does experience these symptoms, we're gonna wanna get an immediate ultrasound to make sure that you're not experiencing a blood clot. A breast reduction surgery is extremely safe. It's amazingly effective. It changes lives. It's the best operation. Even though there are risks associated with it, these are extremely rare events. And just know that a real great medical practice wants you to know about these risks, but wants you to know that we can manage anything and help you heal amazingly well. Lots of luck to you.